Hello, everyone. Dr. Mary with 4 Points Family Chiropractic. I'm here to talk to you today for a few minutes about health longevity, how to assess it, what it is, and how to optimize it as much as you can. And what we're really talking about here is the quality of your life as you progress through it. We don't live forever, but we want to prioritize the years that we do have. There's that old saying, it's not the years in your life, but the life in your years. That's what we're trying to get to, is making sure that you have the opportunity to do what you'd like as long as you'd like to, without injury and as comfortably as you possibly can. So it's the difference between surviving and living. We do a really good job of keeping people alive, but making sure that they get to live optimally is something that takes investment and time and effort, and isn't something that we usually think about until we start to lose the ability to do things. So I want to encourage you, no matter where you are, to start now, just thinking about longevity and what you can do today to start optimizing that moving forward. So step one is kind of knowing where you are in your health and your longevity. So the best way to know that is knowing your biological age. Your chronological age is what everybody thinks about when someone asks you how old you are. So if you were born in 2000, you are 24 years old chronologically. But if you are, if you're 24 years old and you live off of McDonald's and you just sit and play video games all day, then you might be more like 30 as far as your biological age. And your biological age is basically how old your body is and how quickly you are aging. So it takes a lot of things into account, things like your genetics, your lifestyle, your chronological age itself. It takes into account your birthplace, where you were born, how you were raised, your spinal health. All of those things contribute to form your biological age. You could be 70 years old and have been weightlifting and eating clean since you were in your 30s, and you might have the biological age of a 60-year-old. So you're aging at a slower rate because of the investment made previously. So that's the difference between chronological age and biological age. Now, I do tell people, control the controllables. You've probably heard me say that several times if you've ever watched a Facebook Live I have done, or possibly talked to me in person. Control your controllables, meaning when it comes to your biological age, you can't control where you were born, you can't control your DNA. Arguably, you can control how it presents itself, but you can't control the genetics themselves. But you can control things like your lifestyle, your diet, and your spinal health. Obviously, that's where chiropractic comes into play. One of the things that we try to prioritize is making sure we are slowing the rate of aging of your spine and your discs. And if that's something that you are concerned about, or you know somebody who should be concerned about it, and they are in the Austin, Texas area and they want to get checked out, a full exam in our office includes a neurological testing, includes physical testing, posture analysis, any necessary x-rays, and the patient gets a full review with one of our doctors. That's normally $348. If they call and they mention this Facebook Live, or they say the term grip strength, and I'll explain why in a second, then they can get that full exam for $97. So it's a good thing to screen for if there's a concern about longevity, making sure your spine lasts a lifetime. So how do you know your biological age? There are some quizzes online that you can do that ask you a variety of questions about your lifestyle, your background. Those will give you a pretty good idea of where you are, or as you're taking the test, you kind of can hone in on some things that maybe you should be paying attention to. But the best way is actually through lab testing. So you can actually order kits online that do this for you. You can check your DNA methylation, meaning how quickly methyl groups attach to your DNA, which lets you know how quickly you're aging. Or you can get your telomere length tested. And the telomeres are the little bits on the end of the chromosome. As they get longer as you age, so you want them shorter. No, wait, backwards. But it'll test your telomere length, and it'll kind of give you a biological age that way as well. But on your own, the gold standard way to predict your longevity is to test your grip strength, which is such an interesting way to be monitoring your health because it's so easy. It's such an easy thing to do. You can actually just order a dynamometer off of the internet and it'll test your grip strength. And this works for everybody, regardless of gender, age group. There's going to be a normal range for grip strength. And if you have a weaker grip strength, what it does is it indicates that your body's total muscle mass is subpar. It's not where it should be. And then your strength is as well. So what that ultimately indicates is that your quality of aging will be much lower. So grip strength is just a great way to self-assess and then monitor progress as far as longevity goes. It's a really easy way to predict how somebody's going to age, knowing what their grip strength is. So let's see, sorry, moving on to my notes. Yeah, those are pretty easy to get online. Sorry, a cat's doing something. But why does the muscle mass even really matter? So skeletal muscle, it's a supportive structure, but it's also a metabolic structure. So we have smooth muscle, which is like our intestines. The uterus is a smooth muscle. We have cardiac muscle, which is our heart. Skeletal muscle is everything that holds our muscle, our spine together. Now, skeletal muscle is also a metabolic organ. So it burns glucose, it helps control our blood sugar. If you caught our talk on metabolic health on our Facebook Live, then you know how important metabolic health is for aging and overall health. That is available on our YouTube channel if you want to go check it out. But overall, your skeletal muscle plays a huge part doing both things. So they have found a link as far as somebody with a lower grip strength for their age. That indicates that that person is likely at a higher risk for having high resting blood sugar, fasting blood sugar, and a higher A1C. So not having that lean tissue, that muscle strength, puts you at immediate risk for having diabetes, heart disease, high blood pressure. They're so closely linked, which again, I just think is so cool that you can look at a risk factor for things like that just based off of something like grip strength. Again, so easy to assess and to impact as well. So your skeletal muscles burning glycogen, it's controlling your metabolic health, but it also plays a pretty obvious role in longevity here. And this is something you'll hear spoken about more in geriatric health, but it does impact everybody. So say you trip and fall. Your muscles are going to be cushioning that fall and preventing bones from breaking. Now, obviously, the older you get, the more important that is, right? So if somebody who is 80 falls and breaks a bone, that recovery is way more difficult. And they're actually finding that somebody who falls and breaks their hip has a much higher likelihood of morbidity after that. So making sure that there's a cushion there to protect you is going to be a big deal. Sarcopenia is the loss of muscle that does happen as we age if we don't take steps to prevent it. So that's what's happening as far as contributing from your muscle, your skeletal muscle, to your health. The people with lower grip strength are also at a higher risk for that sarcopenia. So it's something to consider there. But aging well and living a long quality of life, you really need solid muscle mass, and it needs to be consistent and it needs to be long term. It's easier to grow that muscle mass before your 40s, but anybody can do it. So you need to determine whether you need to grow the muscle mass or keep the muscle mass. The grip strength is a great way to figure that out. There are other ways to do that. You can talk to your doctor about it. The first way to do it is to make sure, again, your neurological health is strong. We need your nerves, your brain, and your body. That communication is vital for making sure your skeletal muscles grow, develop, do what they're supposed to do with the speed they are supposed to do it in. So if you have lost your balance, the process that happens is first of all, your brain and your body have glitched, right? If you've lost your balance, they aren't talking to each other effectively. Now, when that happens, your skeletal muscles and your neurology, your mechanoreceptors send a signal to your brain, hey, we're falling, we need to do something about that. Your brain sends a signal back down to your muscles and your joints to react quickly and efficiently to catch yourself. If there is any impediment in that signaling, down or up, you're gonna have a hard time catching yourself. So again, this is where chiropractors, we pay really close attention to this. Again, if somebody needs to be assessed for this, they come into our office. We do look at their posture and how their body's reaction time is. We do any necessary x-rays, musculoskeletal testing. We do neurological testing. All of that gets reviewed with a doctor, and then we determine how we can help, if we can help. So if there's someone you know that needs to be assessed for that, they're a fall risk, they've been falling, you've noticed they're unsteady, then if they call our office at 512-345-9355 and they mention this webinar or grip strength, then they can get the full exam. It's usually $348. They can get it for $97. It's a great way to get assessed if it's something that's concerning. Fall risk is a huge concern as we get older. It can go downhill really, really quickly the older you are. But as chiros, we also, chiropractors, we pay attention to reaction times, but we also want to make sure that those signals coming from the brain are as strong as they're supposed to be. What I mean by that, when you go to pick up a weight, say you're weightlifting, if you're doing a bicep curl, you want to make sure you're recruiting all of the muscles that are supposed to be doing the motion as strongly as you can. So if there's an impediment to that recruitment, the whole muscle won't recruit, won't activate the way it's supposed to. It might eventually, but it won't get strong as quickly as it's supposed to. A good example of this is if you've ever injured a joint, the muscles around it almost atrophy sometimes, especially if you've been immobilized, and you have to retrain your body to recruit those muscles to do the job it's supposed to do. Again, that's where chiropractors come in. And PTs as well, we really are assessing for that and trying to recreate that neurological pathway so that your body can do it on its own quickly. Okay, now moving on to how to actually build your roadmap for longevity. So first step, know where you're at, right? Know your biological age versus your chronological age. 2 is figure out whether you need to maintain muscle mass or grow your muscle mass. For probably the majority, 9 out of 10 people watching this, you probably need to grow the muscle mass to maintain. You just want to make sure you're as strong as you can be so that you can age well, the longevity is there. Nothing is revolutionary here about what I'm going to tell you. 90% of your plan is going to be based on the pillars that you hear we talk about all the time. It's things like sleep, movement, good nutrition. 90% of your success is here. There's a lot of biohacking out there and it's all awesome, but that's that last 10%. If you don't have that great 90% foundation, you can do that 10% all you want. It's good, but you're not going to reach yourself up over that health level that you want to be. And success, it lives in your habits. Those day-to-day things that you do, that's where you're going to see the success show up for yourself and where you're going to see the changes. So sleep 7 to 8 hours a night. However you got to do it, make it happen. You got to go to bed earlier. You got to wake up later. You got to put the phone down. You got to not watch TV. Figure out a way as much as you can to get as much sleep. Just hit that 7 to 8 hours. Women actually need a little bit more. We tend to be more like 8 or 9 hours, but try as much as you can to get that to happen. Nutrition, I cannot stress this enough. People are likely not getting enough protein. We need protein for muscle synthesis and muscle strength. So you should be shooting for whatever your ideal weight in pounds is, that's how many grams of protein you should be getting a day. Now, timing's important. The first meal of your day, so your breakfast, if you're fasting, lunch, whatever your first meal of the day is, when you break your fast, shoot for 40 to 50 grams of protein in that meal. That sets your body up for understanding that when you consume fuel, it is going to protein synthesis. It's a pattern to set with your body. So shoot for 40 to 50 grams of protein in your first meal of the day whenever you break the fast. Make sure it's totaling up to whatever amount of grams you have determined that you need. Now, the big thing for muscle strength and skeletal muscle is resistance training. So it's recommended that you get 150 minutes a week of physical activity, dedicated physical activity in as far as working out. And that can be divided between cardio and resistance training, but really try to get 30 to 60 minutes of resistance training and strength training in every single week, however you want to break that up. But you need to make sure you have recovery time in there and that you are doing your training to build muscle strength. So if you can do 10 bicep curls with an 8-pound weight and you've been doing that for years and it's easy peasy and you don't even worry about it, you're not building muscle. You need to be going to fatigue and then building off of that. Now, this is where sometimes it's a good idea to work with a trainer. You can find all of this online, but a trainer is going to be able to assess you and make sure that you are lifting the correct weight, you are building it in the right way, and that you are at the right stage for making sure that you're getting stronger. So don't jump from 8 pounds to 30 pounds, something like that. Make sure you're doing it in an incremental way because you don't want injury, but you do want to be building muscle strength. That's going to be absolutely vital. Something you can consider in the beginning is taking a creatine supplement. About 5 grams of creatine monohydrate will help with that muscle protein synthesis. If it gives you any digestive distress, back off on how much you are taking, but that's really helpful as well. So overall, you also really want to be setting performance indicators. Set some KPIs for yourself. You're the CEO of your health. So find things that are going to be reflective of your muscle strength. The grip strength testing, obviously that's the number one research one, number one indicator. But I also like things like dead hangs. How long can you hang from a bar before you can't hang there anymore? That's an indicator of grip strength as well. Can you go from sitting cross-legged on the floor up into a standing position without using your hands? That's an indicator of how well you're going to age, of your balance, of your leg strength. It can be something simple. How hard is it for you to get up from a chair without using your hands? Can you go from a fully seated position into a standing position without help? Figure out these things that are lifestyle reflections and monitor your progress that way. You can do it with weight and how much you can lift, but I'm much more interested in how that manifests in your life as far as making sure you don't fall, you don't injure yourself, you're able to keep up with everybody, with your kids, with your grandkids. That's gonna be the biggest thing to watch. So again, this is Dr. Mary Elder with 4 Points Family Chiropractic. Thank you for tuning into this. If you have any questions about anything, you can drop them in the comments and we will keep an eye on them and answer them. And if you have any questions and you are in our office, you're one of our patients already, just ask and we are happy to answer. Thank you for tuning in and we will see you in the office.